This conference will now be recorded.
Thank you so much, Rosa, for joining us this afternoon. And we are the National Center for Health and Public Housing. We are going to discuss a little bit about San Ysidro Community Health Center's Women's Health Program and learn from Rosa all the activities and the services that are provided at San Ysidro. Thank you, Rosa, for joining us. First of all, I would like to know a little bit more about the program. If you could give us a program overview.
Sure, absolutely. Let me just go ahead and repeat my name and my title. So my name is Rosa Sandoval, and I am the manager of the Women's Health Department. The Women's Health Department is divided into three groups. We have the Prenatal Program and also the Cancer Detection Program, previously known as the Cancer Detection Program. Now it's known as the Every Woman Counts Program. And also I oversee WIC referrals. So we really want to be able to have our expecting mothers come into San Ysidro Health and really see our clinics as a one-stop shop. So we are patient-centered, and we are also a PCMH medical home certified, and we try to assist our patients with all of their needs. We have patient navigators who are willing and ready to assist our patients to everything from getting an appointment with their physician, or getting a specialty appointment, or even something as simple as if patient is having a difficult time with getting a ride to their doctor's appointment and back, we can provide them with those services as well. Now, yes. Now, with regards to our, I'm going to talk a little bit about our prenatal program, if that's okay with you.
That's fine. That's exactly what I was going to ask you. So go ahead. Thank you.
Okay, wonderful. So we have a CPSP program, and CPSP stands for Comprehensive Perinatal Services Program. And excuse me, this is a service that we have for Medi-Cal eligible women from the date of conception, as soon as they know that they're pregnant, all the way through 60 days after the delivery date. What we see many times is that the patients believe that they can only receive the prenatal program only during their pregnancy, and they think that once they deliver, they no longer qualify, and that simply is not the case. We can continue to see this patient 60 days after delivery date. So what is CPSP? CPSP provides our patients with nutritional services, psychosocial services, and health education. And we work in partnership with our OBGYN providers, with our OB providers. Let's see now. It's a service that we provide them. It really is patient-centered, as I had mentioned, and we try to do the psychosocial, the health education, and the nutrition aspect at every trimester. We reassess. So obviously the needs of an expecting mom during her first trimester is going to change in comparison to the second and then third trimester. So we try to do it at every trimester, and sometimes if patients need that little extra help, you know, maybe they need to see their prenatal case manager a little bit more frequently than others. Maybe this is a complicated case or a complicated patient. Then, you know, we are able to provide them with these with CPSP services as many times as our patients need.
Excellent. Thank you so much, Rosa, for that information.
Sure. I'm sorry. I also wanted to mention that we also do the postpartum assessments. Also, and we provide the patients with their prenatal pills. So we provide them with their vitamin and mineral supplementation during their pregnancy.
Thank you. And in regards to the prenatal program, when you have a new patient, what screening services do you offer to new patients? This is a very good opportunity to screen for tobacco use, alcohol, immunization, some mental conditions such as depression. Are those services offered at the beginning?
Yes, Mhm.
Okay.
Absolutely.
What about it is crucial in that time the administration of folic acid and screening of STDs and education on STD prevention? Is that those services also provided?
Yes, we also provide education on that. So when the patient comes in, and and that's actually in their psychosocial.
Okay.
So we have electronic medical records. I don't know if you guys are using NextGen.
Mm-hmm. Mm-hmm.
Okay, so we use NextGen, and in NextGen we have a whole segment that's just dedicated to our CPSP model of care.
Okay.
So one thing is NextGen that the providers, our doctors are documenting on, and then another aspect of it, of the NextGen, is the CPSP part. And we provide them with everything from postpartum depression. We talked to them about depression, STDs, birth control.
Great, thank you. Now, if we can move on and talk a little bit about your, if I'm not mistaken, your Cervical program is your cancer screening program, right?
Yes, yes.
So
Absolutely.
you are offering services on cervical cancer screening and breast cancer. Am I correct?
Yes, that is correct. The last thing I want just to mention before we talk about
Sure.
the breast cancer and cervical cancer screening is that the CPSP model of care that we provide at all of our clinic sites are culturally sensitive, because, as you know, we are at the border. We are in a border town, and with San Ysidro, so we have a lot of our of our patients who come in with certain ideas of something. So we try to be very culturally sensitive to their ideals or their beliefs. We also do community referrals. If the patient needs resources outside of San Ysidro, we're also able to assist them with community referrals. And yes, so that's about it.
Okay. And in regards to cervical cancer screening and breast cancer screening, are those screening services provided on site? If I'm not mistaken, you also have a unit mobile servicing some patients. Is that right?
Yes, that is correct.
Okay.
So we are able to assist. Actually, we serve over 92,000 patients here in the San Diego area. We have over 15 clinic sites located all over San Diego. So even though the name is San Ysidro Health, we're not just in San Ysidro. We are located all the way up north to National City, El Cajon. So we are, we're pretty much in the larger San Diego area. That said, because we do service over 92,000 patients in San Diego, we have a vast amount of patients who need pap smears, mammograms, and we are able to look onto our list. So we have, let's just say we have like a list of patients that are due for their pap smears, and every month we are updating our list, and we're updating our care guidelines, making sure that our patients that are due for a pap smear, we are being proactive and we are giving them a call. We really want our services to be preventative services. So we're giving them a call, we're scheduling them when it's time for their pap smear or their mammogram. We do have a mobile unit. The medical mobile unit really assists us with childhood vaccines. This mobile unit is located at different of our a couple of our elementary schools here in San Diego. And when it's time, especially right now, is when it's their busiest time, right before school starts, right? Or once school is started. Why? Because children need to get their vaccines, or children need to get their physical exams done. And the great part about this is that they have the medical mobile unit that's right outside. And it is a state-of-the-art medical mobile unit. Everything that you would find at any of our clinics, you would find in this mobile unit. I'm sorry, I'm hearing this screen.
Yeah, we have some feedback noise. I apologize for that. Probably, Anissa, can you please mute yourselves to see if that solves the issue? Yeah, I believe it's much better.
Better.
In regards to cervical cancer screening and breast cancer screening, when you have a kind of normal result, what services are offered at San Ysidro Health? For instance, if you have a abnormal breast cancer result, do you work with hospitals or other clinic in the community where you refer patients?
Yes. Whenever we have a great tracking system because as I mentioned, we're serving over 92,000 patients. So it's easy for a patient to fall between the cracks, right?
Mm-hmm.
But we have a great tracking system. We use eye-to-eye tracks. And the way that eye-to-eye tracks works is that the minute that a patient, let's just say, for example, a patient needs a mammogram. So they have a mammogram done and they have a category 0, and if they have a cat 0, then, obviously the patient needs more studies to be done. And the minute that you enter the information in eye-to-eye tracks, it automatically feeds it back to you. So if you, let's just say if you schedule the patient for, a diagnostic mammogram and then an ultrasound and then, possibly a biopsy, eye-to-eye tracks is right there with you, reminding you, like, now it's time for this. 2 weeks have gone by, and we really use the EWC policies, protocols that are in place. So we make sure that a patient has received their diagnosis 7 days after the mammogram day, after the diagnostic mammogram. So we really try to, use the policies and procedures from EWC, and we are constantly reminding our case managers of the importance, because as we all know, the minute a patient is diagnosed with breast cancer, essentially the clock starts ticking.
Great, thank you. That is very useful. And now, some health centers they are always interested in additional sources of funding. Do you receive funding from any federal organization or state agency to provide these services, or this is everything that you've done is through private insurance and Medicare and Medicaid?
So the vast majority is yes, Medicare, Medi-Cal, Medicaid, and then we do have some insurance. I really don't know the numbers, like what percentage. I can find that out and then get back to you.
Okay, that's really good. And can you please tell us a little bit more about the third component of the Women's Health Program?
Absolutely. So when an expecting mother comes into our clinics, many times they are just coming in because they know that they're pregnant and they're seeking prenatal care. And what they don't know is that we have a wonderful partnership with WIC, in which we refer patients to WIC, and WIC then refers patients back to us. So we have WIC sites within like a 1 mile to, I think, like the maximum at one of the clinic sites is like a 2-mile radius. But the minute that we have a patient that's coming in and she's pregnant, and we ask her a series of questions. One of those questions being, are you already enrolled in WIC? And if she says no, then we have a point of contact over at the WIC center, where we give her a call and we say, we have this patient here, and we have this patient here, and we would like to refer her over to WIC. And her name is Rose, and she's so wonderful. She will go ahead and give us the address and to which WIC site is closest to that patient's home, or to the patient's the home clinic. So and that way we can refer the patient over to WIC. It really is like a one-stop shop. And at the same time, when a patient is coming into WIC and they are expecting, we have WIC referral specialists there who they're asking them, so do you have a provider? If they do and if they're happy with the provider, great. But if they do and they're looking to switch, or whatever the reason might be, or maybe they're just curious to see what other services San Ysidro Health offers, then our WIC patient navigators there at the WIC site will go ahead and send them over to our case managers in San Ysidro Health to assist them with all of their any other service that the patient might need, and obviously that San Ysidro Health can provide for them.
Excellent, thank you, Rosa. And
we're referring both ways.
This is really good, thank you. And San Ysidro is very close to the U.S.-Mexico border, and I assume that you have a lot of patients who are Spanish. Do you have any outreach, I assume, workers, right, who are native Spanish speakers? Sometimes health literacy is a huge issue among Hispanic patients. So do you have materials in Spanish for these patients?
Yes, all of our materials are in English and Spanish. And we're also looking into other languages. Some of our materials are also in Tagalog for our Filipino community. We have a clinic out in National City where the vast majority of the patients there, they are Tagalog speaking. And we also have another clinic, and this is a very unique clinic, all the way out in El Cajon, and they service patients from the Middle East, from Iraq. And we have their big Iraqi community there. And so then a lot of the pamphlets and the flyers that we give out are in English on one side, and on the other side, they're in Arabic.
Mm-hmm. Mm-hmm. Now, among these populations, have you identified any high-risk So, for instance, there are some cultural issues in some patients that sometimes they do not get access. Well, they do get access to some health services, but because of religion beliefs or any other issues, they do not get screened as frequent as other patients. So, have you identified any of these high-risk patients?
That is an excellent question. Yes, we have. So, as I mentioned, our clinic at El Cajon, the CMSS, is the Chaldean Middle Eastern Clinic. As you know, culturally, women, they are very, their beliefs are to always be covered up, not to show any skin. In other words, a male provider, a male doctor cannot see the women. It has to be a female doctor. So we see that with that patient population, we're having a little bit more difficulty with regards to getting pap smears because of the belief that that something bad might happen if you have a pap smear, or that and really these beliefs are, do you speak Spanish? Hello?
Yeah. I'm here.
Okay. So, the just beliefs that cultural beliefs, and that's where we see that we have lower numbers. Patient population. They're not getting their pap smears on time. They're not getting their mammograms done in a timely manner also. So that's where we see difficulty.
Great, thank you, Rosa. Just let me pause the conversation.
This conference will now be recorded.
All right, thank you, Rosa, for all that information. Now, I have probably one more question for you, and this is in regard of needs. What are the biggest needs? What do you are foreseeing? What future interventions do you think are needed in the San Ysidro community?
You know, I think another good question. What we are seeing now is that our patient population is afraid to seek medical services due to the current administration in this country.
Mm-hmm.
So that's one of the things that we're seeing. That said, I can tell you, yeah, like without saying too much, there was a fear out in the community, that that we haven't seen before.
Excellent.
And we're trying to reassure our patients.
Hey, Rosa, go ahead.
And we are trying to reassure our patients and let them know that their information is confidential, but at the same time, we know now that, so before this administration, we would always say that your information is confidential, but now with the current administration, we're seeing that not so much. So we are seeing some patients fearing going to a clinic and maybe giving their address for fear of what may happen.
Yeah, I totally understand. Now, in regards to services, is there any plan to either expand the services or provide additional services?
But right now, San Ysidro Health is always looking to expand.
Mm-hmm.
I know that there are talks there's always talks of of expanding. Is there any additional services that we are looking to provide? Yes, we are looking to provide specialty care to our patients and families. We recently have hired, I believe it's an endocrinologist onto our team. We have OBGYNs, endocrinology, and I believe we're also looking to expand onto other specialties. What specific specialties, I do not know, but I can get that information for you.
Okay, thank you, Rosa.
And we also have psychiatrist.
Mm-hmm. Excellent. Now, what special populations does San Ysidro Health serve? I understand that you have the in addition to the 330E program, you also have the 330H, which is the public housing. Do you have or do you offer services to the homeless population under the the 330H program, the public housing in the 330I?
Yes, we do.
Okay, all right. And one of your clinical sites, or more than your clinical sites, is located in or immediately accessible to public housing, right?
I believe so, yes.
Okay, all right. So we focus a lot specifically on public housing patients, and there is a new hot rule banning smoking in public housing, and I am assuming that you guys are providing additional services, screening services to patients. But this is fantastic. Is there anything else that you would like to add to the interview, Rosa?
Let's see now. No, other than I do know that we're looking to expand onto other specialty care, bringing on board other specialists onto our clinics. But like I said, I don't know what other specialists we're looking to bring on board, but I can definitely get that information for you.
Excellent. Well, thank you so much for your time, for the opportunity to talk to us, and the opportunity for us to learn about what you are doing on all the good work that you're doing in San Ysidro for the population that you serve. Thank you so much.